I know we didn't cover any topics on the first class, so we'll try and have a little bit of conversation about the topics, what we need to do. I think I have already told you what books to study for the surgery exam, and some of you, I recognize some of the faces who are in my practical group as well. Couple of you are in my practical group as well. Okay. Uh, so how many days are you going to have the practicals? When is the next batch changing in the practical group? 15th of April? Okay, fine. So as far as our lecture classes is concerned, we will have series of lecture classes. I know the timing is quite odd. Actually, you were scheduled to have it at 9 o'clock in the morning. But unfortunately, none of our teachers are available at that point of time. So we have to reschedule it at this time. As far as the topic list which is supposed to be covered, we have been given a topic list by the NMC. As I have told you already, the lecture classes which will be taken now won't be repeated until your final years. But honestly, you will learn more if you just correlate your classes with the clinics than just listening to some boring lectures, right? I am not here to give you the definitions. I am not here to talk to you about how the things work, what all definitions you need to do. I'm not going to do that. Those all things are there in the book. You can, as usual, learn it from the book. What we will discuss is just a brief summary of what we are supposed to do in these two classes, right? Right. So the topic of discussion today should be homeostasis, right? Homeostasis and wound management. Wound and wound management. Have you guys done this in the pathology? Homeostasis, is this covered in pathology? ফিজিওলজিতে পড়েছিস? রাইট, একজন 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 আমাকে, you don't have to be in English also, you can just tell it in your local language. What is homeostasis? Right, to maintain a constant internal environment, right? So this homeostasis, see, I will discuss, while I'm discussing the topic, I will do two things at the same time. First, what is going to be a long question and short question in your exam, and what is going to come from the MCQ point of view, which, see, you guys have to give the NEET exam, right? The next exam, next PG, that would be an MCQ based exam. We are not expecting the pattern to change. You won't be drastically asked something new, something different. So whatever the questions we will tell you, those are going to come. In this definition of homeostasis, who coined this term, homeostasis? This term was Claude Bernard, and that is an MCQ. Right. So homeostasis is about maintaining that internal environment, right? Right. And what is a wound? Anybody can define a wound? Wound. 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 Just wear and tear is wound. Okay. Anything else? Any other definitions or anything else? Injury to the skin. Injury to the clotting process. Okay. That's not the case. See, first and foremost, what is homeostasis? Homeostasis is simple. Homeostasis is maintaining everything which is happening in your body, right? There are a lot of things which are happening in your body at the same time. Regardless to the injury point of view, think about it. There are a lot of cells being destroyed at the same time. How do the cells get destroyed? You have heard of the term apoptosis. Apoptosis, have you heard of it? What is apoptosis? Programmed cell death, right? So what is the difference between an apoptotic cell and a metastatic cell? সো দি আইডিয়া ইজ অ্যাকচুয়ালি কি হয় সেটা হচ্ছে যে আমাদের বডিতে There is a replication of cell cycle always going on, right? The cells are always being replicated. Now, as the cells are being replicated, obviously when you are, it's just like a Xerox machine, right? You're producing hundreds and thousands of copies of the same thing. At times what does happen is the Xerox machine gets stuck, right? That same thing happens in your body. There are problems which happens during this replication process. As these things get stuck, there are checks in position to clear these things out, right? And to kill the cell, normally the cell, if the cell is aging and you have to kill the cell, that process is known as apoptosis. The idea is this apoptosis mechanism is supposed to kill all the damaged cells. If this thing doesn't work, if this damaged cell isn't killed at that point of time, it keeps on replicating and it keeps on producing the copies of the deficient system. That leads to carcinoma. That leads to metastasis eventually. Right? So, what is homeostasis? Homeostasis is maintaining everything the way it is, both the internal things and the external body things. It is just to maintain that constant state. Right? Now, we'll come to the injury part. See, a wound is anything. There are few definitions here. Like a wound is a breach in epithelium. The epithelial margin, you know the types of epithelium? Have you read about the types of epithelium? Squamous, columnar, cuboidal, exactly. So breach in epithelium of any kind usually causes a wound. That can be anywhere. That can be internal, that can be external. Skin breach can be external wound, while the mucous membrane breach can be an internal wound. Right? So as I already told you, whenever a wound also breaks down, there are mechanisms to repair that wound. So wound healing is usually a long question. How the wound healing occurs, what are the mechanisms of wound healing, that is again a long question. Now, what is a surgery book? Have you guys bought the surgery book? The theory book, have you guys bought? None of you have brought. That's fantastic. So what happens is, these mechanisms of wound healing, they are usually written there. You just have to go through it. I will tell you it in brief so that when you read it, it wouldn't sound geek to you. Right? So the mechanisms of wound healing is primary wound healing, and there is something known as secondary wound healing. Okay? What is primary wound healing? Primary wound healing is the ideal wound healing, where there you do not get a scar, there is not much inflammation associated with it, and the wound healing occurs very cleanly. That is primary wound healing. About the secondary wound healing, that is something of a pathological wound healing, where there is a scar which is formed, right? And usually the secondary wound healing doesn't occur immediately. Okay, what is inflammation? Have you guys read about inflammation? In pathology, inflammation. So there are 5 parts of inflammation. এক এক করে বল, একজন করে একটা করে বল, কি কি? And calor, rubor, dolor. Redness. It's called functiolesa. Yes, exactly. Loss of function. Right. So is inflammation a normal response or a pathological response? Is inflammation a normal response or a pathological response? Right. So when you get a fever, how do you get a fever? Which prostaglandin? Eventually, yes, the hypothalamus is, it's like the thermostat of the body. So yes, you're right in that saying that hypothalamus is not maintaining that temperature. That's not what I'm asking. I'm asking the mechanism of fever. Nah. PGE2 is not responsible for fever. It is not the main thing which is responsible for fever. Yes. Bradykinin is one of the main things which is responsible. PGE2 is a subsidiary level, which is anyways, it's fine. So the prostaglandins and bradykinins are the ones which are responsible for controlling the fever, right? That is how the fever happens. So when the fever happens, the temperature of the body is raised. Is this a good thing or a bad thing? So temperature rising is a good thing. Then why do we take paracetamols? Hmm, that is not true. Immunogenic response doesn't happen at high temperature. That is not true. So the enzymes are destroyed by heat. That is true. But our body temperature doesn't rise to the point where enzymes stop working. To destroy enzymes, you have to degrade that enzymes. That is degradation of enzymes, for which you have to usually boil it. Your body doesn't reach the boiling temperature. Then why do we decrease the temperature when the fever is there? Is there a reason? Why do we decrease the temperature? Why do we take paracetamols whenever there is any fever? COX2 pathway, yes. No, that I agree. That is not what I'm not asking how paracetamols work. I'm asking why do you need to decrease that temperature? What happens if you have that fever? That is true, but one of the things which comes with see a basic thing. Just imagine the basic thing. We talked about inflammation, right? Inflammation has 5 parts. That is okay. Inflammation has 5 parts, right? One of the parts which you guys told was functionolesa, which means what? Loss of function. So if there is inflammation, your temperature is rising. As the temperature is rising, there are certain things which also lose their function. So while inflammation is good in some aspects, if that inflammation isn't controlled, that will lead to loss of function, right? And that is why we need to decrease the temperature, because our temperature rising after a certain extent, that shuts down a couple of things, because those also lose the function. So inflammation is good, but hyperinflamed response isn't good, right? So that's about the inflammation, that's about the wound healing. Now, what do we do in the perspective of surgery? See, I'm not going to go into the types of mechanism where the neutrophils go and the lymphocytes leave. Those things you will learn in pathology, right? The first 24 hours in the wound, there is hyperinfiltration of neutrophils. After that, there is the lymphocytes which arise. Then after that, there is neovascularization. Those things you will learn in pathology. As a surgeon, that is not my concern. I am not concerned with the fact that there will be, like, after 24 hours, there is neutrophils and lymphocytes. I am not concerned with that. What I am concerned in, and that is where I want to question you, is suppose you have a simple wound, right? What do we normally do? We stitch it up. Simple wound, we stitch it up. What happens if we don't stitch? How does infection, okay, I will take you up on this one. How does infection happen in case of not stitching a wound? What happens if I just leave that wound open? What happens then? That is a good point. A skin is breached, that is breaching the first line of defense. Point number one, taken. I still leave it open. What are the other points that will happen? Eventually, the skin will join, because in 48 hours, see, normal pathology you have already read. In 48 hours, the epithelium is breached, right? So if I just leave it open for 48 hours, it is going to close. Why do I still stitch it? Okay, if it is bleeding, I get it. I have to control the bleeding, I stitching. But suppose, for instance, that wound isn't bleeding. Why do I still need to stitch it? Exactly. So the point is, This is the difference between primary wound healing and secondary wound healing. Primary wound healing is where I'm approximating or I am bringing the edges of the wound together. If I'm bringing the edges of the wound together, that is leading to primary wound healing, right? So the wound healing that will form, after the healing, there will be less scar, right? And the same thing, if I just leave it open, I don't stitch, eventually the bleeding will stop. There is a saying in surgery. In surgery, there was a saying, and one of our sirs used to tell it: all bleeding stops. Eventually, all bleeding will stop. You just have to make sure the patient is still alive until it stops. You didn't get it right. All bleeding will stop. You just have to make sure the patient stays alive. If the patient continues the bleeding, I don't think any patient is going to stay alive in that case, right? So our main motto is to approximate the skin edges, so that leads to better wound healing, right? So that is secondary wound healing. When we stitch it, it is secondary wound healing. Can any one of us tell me what is tertiary wound healing? Okay. So just imagine a scenario in which you have fell down you had an accident, right? And you had a breach, you had a wound in your arm. There is a doctor, which normally happens in your periphery centers. What happens is, the usual doctors who are, or not even doctors, the quacks, what they do is, they do not see anything. They see a wound and they simply stitch it. Problem happens if that is a contaminated wound. What happens if a contaminated wound is stitched together? That will lead to infection. Because what happens in normal wounds, when you fall down on a road, or when you fall down on anywhere, right, there are dirt particles which get into the wound. When you stitch it, you are actually sealing the wound with those dirt particles, and that will lead to bacterial contamination, which is what happens when you see the periphery in your centers, in these areas, the quacks, right, the one who just knows how to stitch, they simply stitch it. Can you tell me of one wound which should not be stitched? There is a particular wound which should never be stitched, and as a medical student, you're supposed to know it. Now, so dog bites. Dog bite should never be stitched. This is a very, very important thing, very important lesson which you must learn now. Dog bites should not be stitched. Why? Can anyone give me the reason why? So, in your see, we as a medical science has developed a lot, right? We almost have cure to everything. There are only a few things which we can't cure. Rabies is one of them. If a person has rabies, that is 100% death. 100% the patient will die. There is nothing in the world you can do to save it. Can anyone tell me why that happens? Why is rabies so dangerous? We have antivirals. Cano. So I can give that saline. আমি saline দেবো ওকে। ও মুখে খেতে পারবে না, আমি ওকে saline দেবো। তাহলে মরছে কেন? ভেন্টিলেটরে রেখে দেবো। Exactly. Eventually, the breathing center is also affected. Rabies, what happens in rabies? Have you guys seen the series? It's a very popular series which was released a while back, The Last of Us. Have you seen it? It was a video game, yes, but it was also a series. Right. So that last of a series also based on a fungal infection, right? Which is uncurable. Rabies is a virus which is again uncurable. What happens in rabies? Whenever there is a dog bite, wherever is a dog bite, suppose that dog was rabid, it carried rabies viruses. The virus starts ascending from the point where the dog has bitten. It ascends where the nerve roots, right? And it will ultimately reach your CNS. And it goes along the pathway as it rises up. It keeps shutting it down. Eventually, all the systems will be shut down, and it is a truly horrifying way to die. Have you ever seen a rabies patient? You won't see a rabies patient normally. I was unfortunate enough to see a one rabies patient. We tried everything and we could not save that patient. The reason was that rabies virus goes into the nervous system. What happens when you stitch? While stitching, suppose the virus was not in the nerves at that point of time. The virus was somewhere, luckily somewhere outside the nerve root endings. When you are stitching, that needle can itself contaminate the wound and the virus can enter the nervous system. So rabies, wherever you're suspecting rabies, that is a dog wound, dog bite wound, you should not stitch. There are few other things, few other interesting viruses and fungi which will most certainly kill you, and we don't have a cure for that. As I told you, rabies is one of them. No, actually, AIDS virus doesn't kill you. AIDS is a state. What is AIDS? Acquired immunodeficiency syndrome. It's a state. It is reached by HIV. HIV doesn't kill you. Remember something, HIV will never kill you. A simple cold will kill you. A common cold will also kill you. Any other opportunistic infection will kill you. But per se, HIV doesn't kill. Now, can someone tell me why HIV cannot be eradicated? So is it the only virus which has that retrograde, RT, so what you mean to say is any virus, yeah, I'll catch you up on that. What any virus which has reverse transcriptase, do you really think it can't be killed? So there was a TED talk, right? You guys have heard of TED Talks? Do you know about TED Talks? TED Talks? TED, T-E-D, TED Talks? Right, there's a very famous TED Talk of Bill Gates. Go today, listen to that TED Talk. In that TED Talk, Bill Gates himself was telling, and that was before that coronavirus struck us. Bill Gates was telling us about how our next, the coming up, the eradication of human species is supposed to be by a virus. Right? A virus will eventually eradicate the human species, and we are long due for that. COVID or coronavirus, remember, had a mortality rate of less than 0.001. What it happened, you already saw. But if any virus even has a mortality rate of 1%, that is going to eradicate half the population. Right? And that's how dangerous the virus is. Anyways, we got distracted by that. But the idea, what I was talking to you about, is dog bite wounds should not be stitched. So what should you do in a dog bite? Exactly. You should go for washing it under running water. Right? Should you use soap to clean it? What happens if you use soap? সোপ ইউজ করলে কি হবে? সো জল দিলে জ্বালা করবে না? Actually, there is no theory to that. You can use soap while clearing it. You can use. But the idea is just to clean it and leave it open. the idea is not to stitch it. And you should obviously go for anti-rabies vaccine, right? Anyways, so that is an example of secondary wound healing. When you stitch, in case of an accident, as I was talking to you about, you leave that wound open and eventually that wound shrinks and then you stitch it. That is an example of a tertiary wound healing. So the tertiary wound healing is when you don't immediately stitch it. You leave that wound open, you wash it a couple of times so that all the contaminants of the wound is cleared, and then you stitch it. Clear? So that is tertiary wound healing. So just to recap, what is homeostasis? You already know. It is just the maintaining of the inner and outer things. Just the inner and outer state is maintained. The definition of homeostasis won't be asked, but who coined that term homeostasis will be asked. Right? Coming to the wound part, what is a wound? It's simply a breach of epithelium. Can be anywhere, can be inside, mucus, can be skin, anywhere. What are the stages of wound healing? There are 5 stages of wound healing that you will read in pathology, where the neutrophils first come, then the lymphocyte comes, neovascularization occurs. It's a pathological topic, you will read it. From the surgical point of view, just 3 things. What is primary wound, what is secondary wound, and what is tertiary wound. Right? Eventually, you will learn about classifying the wounds. Clean, contaminated, and dirty wounds. I won't teach you that today. Some other day in your final years. Now, it's not the point of discussion. Clear? Right. So, give the attendance. Attendance, Nino. And anyone has anything to ask about?